People are like, "What did she do?" Like, I need to know. What water is she drinking? Because 'Cause I'll take a side of that as well.
I think social media hates plastic surgery is its perceived negativity. Like the before and after results, hey, they're great. And a lot of times they're functional and beautiful, but it's seen as body shaming.
So I think sometimes, like, you can look at these pictures or influencers on social media video, and it looks so beautiful, it looks so real, and it just seems, like, unattainable, but it's not real. Everything is filtered.
We know, you and I both know that some of these things are impossible to correct with diet and exercise and avocados and olive oil and stuff like that. You just need a procedure.
The beauty scientists, Dr. Christy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Welcome to the Beauty Scientist. I'm Dr. Christy Hamilton here with Dr. Roy Kim. We are both board certified plastic surgeons, and we are the Beauty Scientists. And today we're talking about a topic that's very near and dear to both of our hearts. And I'm with social media expert Dr. Kim too, and he'll tell us about all the hats you wear in that arena. But we're talking about social media and how it is unique in plastic surgery. They cross influence each other, and I think it's a really fascinating topic, and both of us have a special interest in it.
Hey, Christy, I'm glad you're doing well. And if, I mean, you're a social media expert along with me. So for me personally, I'm the social media editor for PRS Journal and PRS Global Open, which are the two biggest journals in plastic surgery. But don't hide because Christy, you're doing something with ASPS, correct?
That's right. I am the committee chair for the American Society of Plastic Surgeons for the social media committee. So there's a lot of upside or through our interest in social media. So there's always two sides of everything. And there's a lot of good in social media with plastic surgery, the networking element, the connections with patients and that educational platform. And then maybe there's another side that needs to be managed a little bit more. But first, the patient facing side. So why does social media seem to, or the algorithms at least, why do the platforms seem to hate plastic surgery and plastic surgeons, and yet it's like all over everyone's feeds? Like, how do you
Yeah,
explain this?
it's interesting because as a consumer, as a patient, like honestly, as a consumer, if you don't care about plastic surgery, you can just scroll by or skip it. But I think social media hates plastic surgery is its perceived negativity. Like the before and after results, they're great. And a lot of times they're functional and beautiful, but it's seen as body shaming. Beauty improvements are sort of interpreted as like promoting unrealistic beauty standards. The graphic content can be graphic, maybe not to us as surgeons, but again, if you're a non-surgeon, it could be pretty graphic. Like a lot of the operating room videos have like a banner on it saying this is like raw content or whatever. And honestly, I think the social media platforms hate that it's so interesting. Consumers want to watch it, and plastic surgeons just posting their normal day-to-day stuff. We don't necessarily have to pay for that much advertising for people to see our stuff because consumers already like our stuff.
And I think it's interesting that Instagram or TikTok sometimes views it as like, I'll get flagged for violence, and it's like a needle injection.
Right.
Or it'll be a before and after of like a tummy tuck, just the tummy, and it'll say pornography. But I agree with you. I think that overarching thought is like that there was something wrong with the before. And of course, we're talking aesthetic plastic surgery, and there isn't. There's just changes that happen, aging, pregnancy, life. And sometimes patients want to undo those, and they're things that can't be addressed in the gym or with diet and exercise and healthy lifestyle. So it's really like a body positivity. It's like it's patient's choice. And I think that's what the algorithms can't quite understand. It's not something to be forced on someone. It's something that patient was willing to share with the world in the hopes that it might help somebody else.
Yeah. And that's another important thing you bring up is that we're doctors. There's federal privacy laws. We're not posting stuff unless we get patient permission. So I think that's very important for our audience to understand. And a lot of patients are very happy to be part of the educational process, maybe be part of the inspiration process, because we know, you and I both know, that some of these things are impossible to correct with diet and exercise and avocados and olive oil and stuff like that. You just need a procedure.
Yeah. So I think, yeah, it's interesting, like maybe how we view ourselves and view our own patients. And yeah, like every patient that gives permission, I mean, I'm sure this happens with you all the time. Like patients may initially come and saying, like that's not really for me. This is like a private experience. I don't want to share, and that's totally fine. And then I'm surprised how often, like after everything is done, patients will kind of come back, having healed, having had their experience, and go, you know what? I know I originally said no, but it was so helpful when I was deciding what to do, to see those before and afters, to see like patients and the journey and changes over time. You know what? I actually am okay with you sharing. And in fact, I'd like you, in the hopes that like they can kind of pay it forward to somebody
Yeah,
else. And
absolutely.
I think that's really nice. And everyone has a little bit of a different experience. And so the more you can kind of like crowdsource those, I think that gives patients even more power and information about making a really informed decision for themselves.
I really think if we are as transparent, as authentic as possible, that'll shine through on social media, on Instagram, on whatever. And patients can definitely feel it. They could see it visually, of course, but they can really feel it, which sort of gets into like the next topic. Why is plastic surgery so perfect for social media? What are your thoughts?
I think, to your point earlier, that just like that boom before and after, like everyone loves like a really great transition in social media, and people like also like want to see like what something started with and what it became. And that's why I think the things that end up trending more or potentially going viral are like the most dramatic transformations. And those are things like, truly oftentimes it's just say only surgery can do. That can be like a positive and a negative, right? Because then also, like, I think sometimes patients think that, oh, plastic surgery is only for these like really dramatic transformations, when in reality, a lot of them are not so much transformations as like subtle enhancements. So I think it skews what we see. But I think people are like inherently really curious about, what goes on in plastic surgery, whether or not they're even someone that's considering a procedure. It's interesting.
Yeah, I think that it plays into the what makes us human. And this is all about storytelling. So way back when we're all in caves and we're around a fire, someone's the storyteller. So with the internet, the media, there's a story. There's a problem, there's an obstacle, there's a solution, and then here's the result. But because it's so visual, I think that's why plastic surgery is perfect for social media. And I also think it fits in with other consumer interests like celebrities, beauty, wealth, sophistication, a lifestyle, certain things like that, which I definitely see more, maybe more holistically, like being healthy and being confident and being happy with yourself is a big part of life.
Yeah, and I think to your point too, like that like what's everybody else doing, you know? I think that's why I mean there are social media accounts devoted just to celebrity plastic surgery, or celebrity interventions. Like what did they do? And that's not necessarily what you or I post about, but those accounts do really, really well because people are like, what did she do? Like I need to know. What water is she drinking? Because I'll take a side of that as well. And yeah, I think it certainly can be aspirational for people, or just like there's kind of like a voyeurism component of it too. Like even if this is something like you don't want for yourself, like it's just really interesting to watch and see what's possible. So these can be all positives, like the educational component, which I know we'll get to, just information sharing, crowdsourcing. But then there's the dark side, the reality of the situation. And what do you foresee, or the lack of reality, I should say? What do you think are some of the pitfalls that patients and just people in general fall into?
I think to be very candid, we all know that everything's filtered. Like social media in general, you're not posting about the worst things that have happened today or in your life. Typically, you're posting your best moments. With plastic surgery, you're posting the best results. With patients, they need to understand that some of the celebrities in general, or even influencers, or heck, even your friends, they're not posting photos of themselves tired, shape, and with no makeup on. They're posting, stuff where they're looking good and feeling good. I think the other thing is this may surprise people. we all know that iPhones and Android phones, they actually have software algorithms that create certain filters for portrait mode. Modern cameras today, when you take a portrait, it's actually not a true portrait. They're actually using software through the glass lens to soften your skin and make you look better. If you use that same sort of software mode to take a landscape or take a picture of a flower, it actually looks a little different. So everything's filtered in our world.
Whether intentionally or otherwise, like you may not even know. And then, of course, I mean, you look at pictures of these like beautiful celebrities and models, and the picture that you see, on the front page of your like news feed when you open, like that's with full makeup on, full contouring, the abs are enhanced with makeup, and then it's edited on top of that. So I think sometimes like you can look at these pictures or influencers on social media, video, and it looks so beautiful, it looks so real, and it just seems like unattainable, but it's not real. Everything is filtered. Some people rather unscrupulously will even filter or edit before and afters. Obviously, ethical people won't do that, but that's the reality. We used to say, okay, well, then go for video because video you can't edit that, but you can Facetune and edit video now. So really, you just have to you know make sure that if you are pursuing these procedures, you like trust the people that you're going to, and just getting to know your surgeon, the practice, and then make sure you're always doing like a double check on reality because life is not as filtered as social media may make it seem. So that I think, especially with younger patients, young women, that's something, you know, that we just need to be reminding everybody that there is no such thing as perfect, despite what it looks like.
Yeah, I mean, honestly, someone told me this. This is a quote. Even the models don't look like models when you meet them in reality. The
Yeah,
post production, yeah. I mean, I'm sure you've met models, you have beautiful patients and wonderful, highly confident men and women in your practice, and they look a little different sometimes, depending on makeup, lighting, all that good stuff.
yeah, they know how to turn it on for the camera, and the ones I know, mainly women, they kind of just transform, like in the spot, like they truly are like entertainers, like performers, and they've got that it factor. But they're applying their makeup, like doing all those things, working with other professionals to really complete that transformation, and then oftentimes pursuing like smaller surgical interventions too to kind of maintain or enhance their beauty. So there's a lot going on before the camera editing even kicks in. So that's, more and more in like patient consultations, I'll see patients come in and go like, okay, well, I really like how I look, but like there's like this one picture, I don't like this shadow. And I'm like having to kind of redirect and be like, okay, but we're not gonna permanently try to change your face or body because we don't like this one photo of you. Now it shows up in every single picture. I'm like, okay, let's see. But again, we got to see it in reality because it could be like someone shows something. I'm like, oh, it's this terrible lighting. You're being like cross-lit across your face or like backlit. It's like making the folds on your face look really, really deep. But like again, that's just, a bad filter. Like the opposite of a beauty filter, but we're not going to do something drastic because you didn't look ideal in one picture one time.
I'll start with part 5, and I'll just do a
Yes.
quick intro and then ask you some questions, okay? So I know that, Christy, you and I are both heavily involved with social media, patient education. Do you have any hints for people out there that are interested in a procedure, whether it's non-surgical or not, to use social media to help them educate themselves and pick what's best for them?
Yes. Use it as a tool. I think you and I, our primary focus, I think, for social media is education. And so, similar to when a patient comes in for a consultation, and I encourage them to see like a couple of different people, something I tell them is you should be hearing similar messaging from at least the majority of the people that you're consulting with. And you can use social media in the same way. You can kind of seek out information, filter it. If you see some like outlier fringe stuff, maybe like asterisk that. But you should kind of get like more of like a mainstream, consistent level of information. And I think that's helpful. Also, patients use it to like discover new things that they maybe like hadn't heard about, other options. And I think it's always good having more options and knowing what questions to ask. So use it as an educational tool and just don't dive in too far down the rabbit hole and don't take everything that you see on social media as dogma. Like you do have to find surgeons and physicians that you trust and then use that like as just another data point.
Yeah. And then going with photos and social media in general, you can save certain results you like. Make sure that the after photos show the same pose and lighting before and afterwards. One of my pet peeves is when the after photo has a patient obviously wearing nicer clothing and makeup and better lighting. I don't think that's a true after photo. And, overall, I tell my patients comparison is the thief of joy. Like you're you, and that's your superpower. And so you can't really totally compare yourself to other people because they're not you and you're not them. So it's important to sort of realize globally what can be done, but it has to be sort of customized to you.
I completely agree. And like when you're looking at photos and videos before and after, and granted, sometimes patients are remote and that's just what they're sending in and, asterisk, asterisk. But the plastic surgeon should be pointing that out. But like the classic that I always see is a backlit before and then a front lit after. And so you can make someone look so shadowed and so dark if you backlight them. And it's like the same reason why a ring light, like people love that when we're filming. It makes everyone look better. And I call it the instant before and after. You can kind of take 15 years off someone's face just by changing the lighting without doing anything else. So you should, and often in the afters, patients do come in with makeup, and that's just how people show up in your clinic sometimes. But you're right. The like true formal before and afters, you want to see like the exact same setting, same lighting, no makeup as best you can to really judge them. But know that you can edit any of this stuff now, and it's really hard to detect. But again, the people that you're talking to, they should be acknowledging those shortcomings if they're looking at photos and kind of explaining, what's realistic, what you can expect, and how it might look for you specifically.
Yeah, I totally agree. So I hope this advice for patients out there is helpful on choosing, which plastic surgeon, which procedure, getting realistic expectations of what's going on. So is there anything else you wanted to talk about today, Christy?
I think I'll say I'm a fan. I enjoy social media. I think there's a lot of value to it. Just maintain a certain level of healthy skepticism, ask a lot of questions, and that'll keep you safe and well informed.
Totally agree. And it's actually very cool that you can save images, save stuff, but definitely is so educational. Take notes on what you like and what you don't like. And that should really help you if you're searching for a procedure. So this is the end of this episode. And I thought it was a fun episode talking about social media, the good things, the bad things, why we as plastic surgeons think that social media companies hate us. But to be honest, we're in an interesting field, which is why it has so much power on social media. So if you like this, please let us know. If you have any questions about social media, even the details about, let's say, before and after photos or certain procedures, please get in touch with Dr. Hamilton's office or my office. And as always, stay beautiful.
Stay beautiful.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.